So students, now we'll discuss about fibroid. Now ये fibroids को हम एक और नाम भी देते हैं, we called it as myomas, or you can also call them as what? Leiomyomas. Leiomyomas. So these are the other name of fibroid. Now ये जो fibroids होते हैं basically ये क्या होते हैं? These are nothing but these are the benign tumors, okay? जिनकी मेन origin कहाँ से होती है? From the muscle layer of the uterus, that is myometrium. So write it down. What is these fibroids? These are solid benign pelvic tumors, mainly originating from where? Mainly originates from muscle layer of uterus, और muscle layer का क्या नाम है? That is myometrium. Mainly myometrium से originate करते हैं ये fibroids. Now let's discuss about their histogenesis. Let's discuss about the histogenesis of fibroids. Generally अगर हम etiology की बात करें, वैसे fibroids की etiology is not clear, हमें पता नहीं है कि क्यों ये होते हैं, but जो most prevailing hypothesis है इनकी origin के regarding, वो ये है कि it generally arises from a neoplastic single smooth muscle cell of myometrium. So what is the most prevailing hypothesis? That fibroids generally arises from single smooth muscle cell of myometrium. इसीलिए हम fibroids को क्या कहते हैं? They are monoclonal. So fibroids are what? Fibroids are monoclonal because they arises from same cell, or you can say from one cell they arises. Okay. Now these are generally the most common benign pelvic tumors in the females you're gonna see. So let's discuss about what are the risk factors that causes fibroids. So we'll discuss about the risk factors of fibroids. So जो first risk factor आपने याद रखने हैं, that is high estrogen level. So अगर किसी फीमेल में ज़्यादा estrogen level है तो this can be the cause of originating of these solid benign tumors that are fibroids. Second, after estrogen, which hormone is responsible? Then high levels of progesterones are also responsible, but estrogen ज़्यादा responsible है. ठीक है? Now what is the mechanism? Why जो estrogen है वो generally fibroids cause करता है? Because see, ये जो both hormones हैं, estrogen and progesterone, ठीक है, इनके receptors बहुत high concentration में present होते हैं ये fibroids पे. ठीक है, तो अगर ज़्यादा receptors present होंगे estrogen और progesterone के fibroids पे तो क्या होगा? इनका ज़्यादा लेवल होगा तो फाइब्रॉइड ज़्यादा ग्रो करेगा. दूसरा, ये जो मायोमास सेल्स हैं जनरली दे हैव हायर लेवल ऑफ द एंजाइम एरोमेटेज, ठीक है। और आपको पता है एरोमेटेज क्या करता है, एरोमेटेज ईस्ट्रोजन के लेवल को और बढ़ाएगा, ठीक है। सो बेसिकली व्हाट इज द पैथोलॉजी हियर, जनरली myomas has high or increase higher concentration of receptors for estrogen and progesterone, ओके। और दूसरा, these myomas has enzyme, that is what enzyme, aromatase, जो कि क्या करेगा, that will increases the estrogen concentration, ठीक है। नाउ ये जो मायोमास है जर्नली आफ्टर द मीनोपॉज और यू कैन से बिफोर द मिनार्की ये कभी नहीं होंगे, ठीक है। पीरियड्स की स्टार्टिंग से पहले और मीनोपॉज के बाद फाइब्रॉइड्स का रिस्क बिल्कुल नील हो जाता है। क्यों? बिकॉज ईस्ट्रोजन और प्रोजेस्टेरोन नहीं होते हैं तब। So these hormones were not present before menarche and after menopause. That's why the prevalence of fibroids decreases after menarche, before menarche and after menopause. Okay? So write it down. Before menarche and after menopause, the prevalence of fibroids decreases. क्यों? Because there is a decrease in estrogen and progesterone level. Because of decrease estrogen and decrease progesterone. So बहुत ही रेयर है कि मिनार्की के बाद फाइब्रॉइड्स रहे। और दूसरी चीज़, अगर किसी फीमेल में फॉर एग्जाम्पल फाइब्रॉइड्स थे, नाउ शी हैज़ अटेन द मीनोपॉज, तो उसके बाद क्या होगा, इसको ट्रीटमेंट की ज़रूरत है। सो देर इज़ अ नो नीड ऑफ ट्रीटिंग द फाइब्रॉइड्स आफ्टर मीनोपॉज। वाई? बिकॉज देयर साइज ऑटोमेटिकली shrinks. So write it down. After menopause, the size of fibroid decreases, hence there is no need of treating them, hence no treatment need. Okay. Second, जो भी hypoestrogenic conditions हैं, they will reduce the size of these myomas. So write it down. All hypoestrogenic conditions decreases the size of myomas. Okay? ये क्या कंडीशन हो सकती है हाइपोइस्ट्रोजेनिक? जैसे कि इफ यू आर गिविंग द gonadotropin releasing hormone agonist, then that is you are creating a hypoestrogenic stage. Okay. After that, just remember these fibroids, these myomas generally increases in size during pregnancy. प्रेगनेंसी में इनका साइज बढ़ जाता है. क्यों बढ़ जाएगा? बिकॉज आपको पता है प्रेगनेंसी में ज़्यादा हार्मोन प्रोडक्शन होगी ईस्ट्रोजन प्रोजेस्टेरोन की. दैट्स वाई देयर साइज जनरली इंक्रीजेज इन प्रेगनेंसी. ओके, सो again revise it. So first risk factor we are discussing now, and we said the high estrogen is a culprit here for causing fibroids. Even though the high progesterones are also there, but estrogen ज़्यादा cause करता है fibroids को. Because क्यों cause करेंगे ये hormones fibroids? Because जो generally myomas है उनके ऊपर estrogen and progesterone receptors high concentration में होते हैं. And when these myomas come in the contact of these hormones, their size generally grows. Now, after the menopause, or you can say before the menarche, क्या होता है? हार्मोन प्रिविलेंस ईस्ट्रोजन और प्रोजेस्टेरोन की नहीं होती, इसीलिए कभी भी मेनार्की से पहले मेनोपॉज के बाद फाइब्रॉइड्स नहीं होंगे. अगर किसी लेडी में फाइब्रॉइड है और उसको मेनोपॉज आ गया है तो देयर इज अ नो नीड टू वरी, नो नीड टू गिव द ट्रीटमेंट एज वेल, बिकॉज द साइज विल ऑटोमेटिकली श्रिंक्स आफ्टर द मेनोपॉज. अभी मैक्सिमम साइज, और यू कैन से साइज कब बढ़ेगा फाइब्रॉइड का? इफ शी बिकेम प्रेग्नेंट, क्योंकि प्रेगनेंसी में देयर इज अ मोर प्रेवलेंस ऑफ दीज हॉर्मोन्स, दैट इज ईस्ट्रोजन एंड प्रोजेस्टेरोन. So just remember these points. Now the second risk factor for the fibroid is genetics. Second is genetics. यहाँ पे मेनली आपने याद रखना है ट्रांसलोकेशन ऑफ क्रोमोसोम 12 and 14 is mainly the risk factor. So, translocation of chromosome 12 and 14 is the main issue. यहाँ पे क्या होगा? 12 की ट्राइजोमी होती है and 14th की डिलीशन होगी. ओके, 12 की ट्राइजोमी एंड 14 की डिलीशन होगी, एंड दिस ट्रांसलोकेशन में देयर इज अ मोर रिस्क ऑफ फाइब्रॉइड. नाउ द थर्ड रिस्क फैक्टर इज व्हाट? दैट इज नल्लीपैरिटी. नेक्स्ट रिस्क फैक्टर फॉर फाइब्रॉइड इज अर्ली मेनार्की and late menopause. Now why this early menarche and late menopause is a risk factor? क्योंकि अगर इस फीमेल को पीरियड जल्दी शुरू हुए और लेट ख़त्म हुए तो क्या होगा? जो ड्यूरेशन है हार्मोन के एक्सपोजर का दैट विल बी मोर, सो देयर विल बी मोर रिस्क ऑफ fibroids. Just remember, okay, because of the exposure factor, this early menarche and late menopause is causing what? Fibroid, risk to fibroid. And after that, fifth risk factor is obesity. So as you know, obesity क्यों? Because जो obese females होती हैं इनमें एक एंजाइम प्रेजेंट होता है, मेनली adipose tissue is containing that enzyme, that is aromatase. तो आपको पता है एरोमेटेज का क्या फंक्शन है? दैट विल इंक्रीजेज द ईस्ट्रोजन. सो हियर aromatase is present, which leads to more level of estrogen, and hence obesity is a risk factor for fibroids. Now the sixth risk factor is the reproductive age group between 30 to 40 years. तो 30 to 40 years की जो females हैं, these are also at a risk of getting fibroid. Then after that, seventh is high socio-economic status. Economic status. ये जो females होती हैं generally because of their sedentary lifestyle, because of everything, there is a more risk of obesity and hence you can say there is a more risk of fibroids. Okay, because of their lifestyle, estrogen generally इनमें ज़्यादा होता है. ठीक है. After that, the eighth risk factor, and it is very important, that is increase of certain growth factors can lead to fibroid. अब कौन कौन से ग्रोथ फैक्टर्स फाइब्रॉइड कॉज कर सकते हैं? सो द फर्स्ट ग्रोथ फैक्टर दैट यू नीड टू नो इज, सो दैट इज ट्रांसफॉर्मिंग growth factor. Second one is the platelet derived growth factor. The third growth factor is the epidermal growth factor. And the fourth growth factor is what? VEGF. That is vascular endothelial growth factor. So if these growth factors increases, so there will be more risk of getting what? Of getting fibroids. Okay. Now the next thing that we're going to discuss is the protective factors. So let's discuss about the protective अब कौन कौन से ऐसे प्रोटेक्टिव फैक्टर्स हैं जो आपको प्रोटेक्ट करेंगे फाइब्रॉइड से? सो फर्स्ट वन इज द फिजिकल एक्सरसाइज. फर्स्ट इज फिजिकल एक्सरसाइज. बिकॉज फिजिकल एक्सरसाइज करोगे तो देयर विल बी लेस चांसेस ऑफ ओबेसिटी, लेस aromatase will be there and less estrogen will be produced. Second one is smoking. आपको पता है स्मोकिंग क्या करती है? स्मोकिंग जनरली इनहिबिट एरोमेटेज, तो ईस्ट्रोजन भी कम बनेगा. So smoking is a protective factor. After that, the third factor that is act as a protective, that is late menarche. Late menarche. अगर periods late start हो रहे हैं तो that is a protective factor for fibroids. After that, the fourth factor that is a protective factor, that is multiparity. Multiparity. Fifth factor is combined oral contraceptive pills. Combined oral contraceptive. So these are all what? These are the protective factors. Now when you do the gross examination of fibroids, तो आप क्या क्या देखते हो वहाँ पे? So gross examination. So जो फर्स्ट करेक्टरिस्टिक फीचर होता है फाइब्रॉइड का, दैट इज इट इज वर्ल्ड स्ट्रक्चर. इट इज वर्ल्ड होता. जैसे इफ दिस इज अ फाइब्रॉइड, तो ऐसे these are like this. So whorl structure होता है actually fibroid. Second one, if we talk about the consistency of fibroid, so it is having that rubbery consistency. It is firm actually. So it is having rubbery consistency. After that, the third thing you can find on gross examination, that is, it is having pseudo capsule. Pseudo capsule is present. And ये pseudo capsule क्यों होगा? Due to the compression of surrounding tissue, this will form. So this is due to compression of surrounding tissue. Surrounding tissue. Okay. After that, the fourth thing you will see, जनरली जो फाइब्रॉइड्स होते हैं ना, इनकी जो वैस्कुलैरिटी होती है, दैट इज जनरली पेरिफेरल. दैट इज पेरिफेरल वैस्कुलैरिटी इज प्रेजेंट. वैस्कुलैरिटी मीन्स इफ दिस इज अ फाइब्रॉइड, तो जो भी ब्लड वेसल्स होंगी मेनली इसकी पेरिफ्री को ज़्यादा सप्लाई करेंगी rather than the center of the fibroid. This is a center. So center area is less vascularly supplied. More कहाँ पे होगी? Periphery में ज़्यादा supply होगी fibroid. Okay. So gross examination पे the fibroid is a whorled structure. It is having the rubbery consistency. It is having the peripheral vascularity and it is having pseudo capsule. और वो कैसे बनेगा? Due to the compression of the surrounding tissue, this forms. Now, so let's discuss about the types of fibroids. Types of fibroid. So generally, these fibroids are classified into two types. What are those two types? Here, these fibroids are of two types. First is uterine fibroids. First is uterine fibroid, and the second one is the extrauterine fibroid. So first is the uterine fibroid and second type is a extrauterine fibroids. Okay. अब यूट्राइन फाइब्रॉइड्स क्या होते हैं? जो फाइब्रॉइड्स इनसाइड द यूट्रस प्रेजेंट होते हैं उनको हम यूट्राइन बोलते हैं. एक्स्ट्रा यूट्राइन मीन्स जो यूट्राइन कैविटी के बाहर होते हैं उनको हम क्या बोलते हैं? एक्स्ट्रा यूट्राइन फाइब्रॉइड्स. ओके. नाउ लेट्स सी द डिफरेंट टाइप्स ऑफ uterine fibroids. Now ये uterine fibroids further, they are of three types. What are those three types? The first one is intramural fibroid. Intramural uterine fibroid. This is also called as interstitium fibroid. The second type of uterine fibroid is what? That is submucous fibroid. Submucous fibroid. And the third variety is that is subserosal fibroid. So basically आपने यहाँ पे three varieties of fibroids याद रखनी है. One is the intramural or interstitium, second is submucosal and third one is subserosal fibroid. ठीक है. Now let's discuss about these fibroids first and then we will move to the extrauterine fibroid. So out of these three fibroids, the most common one is this intramural. This is the most common fibroids. Around 75% cases में intramural या interstitium fibroid present होगा. Now how this fibroid will look? So basically this is the uterus. Okay. Here is the endometrium and this one is the myometrium. Okay. Now, if the fibroid is present in the myometrium, the fibroid is confined to the myometrium, we called it as a intramural or interstitium fibroid. Okay, so write it down here. Fibroid is confined to myometrium. So this one is what fibroid? This is intramural. So this is the intramural fibroid. Now if we talk about the second fibroid, that is the submucous fibroid, so ये कैसा होगा? So let me draw the uterus. This is a uterus. This is the endometrium and here is the myometrium. Here is the myometrium. Now when this intramural fibroid is pushed towards the endometrium, we called it as submucosal fibroid. So when this intramural is pushed towards the endometrium, so basically this fibroid is what? This is the submucosal fibroid. So can you see यहाँ पे जनरली पहले जो ये फाइब्रॉइड था वो मायोमेट्रियम के अंदर ही था, अब ये फाइब्रॉइड थोड़ा सा किधर आ गया है? टुवर्ड्स द एंडोमेट्रियम. So basically this is what? This is the submucosal fibroid. So how you gonna define this? Intramural fibroid pushed towards endometrium, or you can just write it like this: fibroid pushed towards myometrium is called as the submucosal fibroid. Okay. Now let's talk about the subserous fibroid. So here, if this is the uterus, this is the endometrium. Here I am drawing the myometrium. Now when this intramural fibroid is pushed towards the outer side or towards the serosa, you can say, so we called it as subserous fibroid. सो कैसे, जनरली ये फाइब्रॉइड यहाँ पे था सेंटर में, नाउ इट इज पुश टूवर्ड्स द serous layer of the uterus. Now can you see this fibroid is pushed outwardly. So this is what? This is the subserosal fibroid. Now how are you going to define this fibroids? When the fibroid is pushed towards the outermost layer, that is serosa, we called it as subserosal. Fibroid push towards outermost layer, that is what layer? Serosa, towards serosa, we called it as a subserosal fibroid. Okay. Now just see, when this intramural fibroid is generally pushed towards the peritoneal cavity, this is of two types. ठीक है, either this fibroids are partially or this fibroid can be completely covered by the peritoneal layer. Okay, so this subserosal fibroid can be partially or completely covered with peritoneum, and when this fibroid is completely covered with peritoneum, when it is completely covered with peritoneum, it attains a pedicle. It attains pedicle, and we call this fibroid as what? As pedunculated subserosal fibroid. Pedunculated subserosal fibroid. Okay, so just remember this about the subserosal fibroid. So now we will discuss about the second type of fibroids, that are the extrauterine fibroid. Extrauterine fibroids. So these are the basically fibroids जो कि आपको यूट्रस के बाहर देखने को मिलेंगे. So ये एक्स्ट्रा यूट्राइन फाइब्रॉइड्स भी दो टाइप के होंगे. ठीक है, द फर्स्ट वैरायटी ऑफ एक्स्ट्रा यूट्राइन फाइब्रॉइड इज द सर्विकल फाइब्रॉइड्स. Cervical fibroids. And the second type of these fibroids is the broad ligament fibroids. Broad ligament fibroid. Okay, so दो टाइप के हैं ये, cervical and broad ligament fibroid. Okay, नाउ ये जो सर्विकल फाइब्रॉइड है इसकी फर्दर टाइप्स होती हैं. सो लेट्स नाउ डिस्कस अबाउट द सर्विकल फाइब्रॉइड्स. सो बेसिकली द सर्विकल फाइब्रॉइड्स आर ऑफ थ्री टाइप्स. These are of three types. What are those three types? That is anterior cervical fibroids. Second is posterior cervical fibroids, and the third one is lateral wall cervical fibroid. So three types: anterior wall fibroids, posterior wall fibroids and lateral wall fibroids. Okay, so ये जो anterior wall cervical fibroid ये कैसे होंगे? So see, if this is the uterus, okay, This is the uterus, here is the cervix, and this is the vagina. Okay. Now when the fibroid is present anteriorly here, posteriorly means cervix के पीछे, so it should be like this, and other position is laterally, like this can be lateral to the cervix. So this red color वाले क्या है? These are lateral fibroids. This is anterior fibroid and this one is the posterior fibroid. Now, when the fibroid is present anteriorly, it can cause high frequency of micturition. So, what this anterior fibroid can cause? This can cause high frequency of micturition. Okay. Secondly, this posterior wall fibroid, this generally causes the retention of urine. This will cause retention of urine. And secondly, this fibroid when it grows ना, तो ये क्या करेगा? Compress कर देगा anus को. So that's why it can also cause constipation. It can compress rectum and hence it can cause constipation. Okay. So anterior fibroid वाले क्या कर रहे थे? Anterior cervical fibroids are generally causing the high frequency of micturition. So this posterior wall cervical fibroids causes the retention of urine and constipation. Now if we talk about the lateral wall of fibroids, these generally cause hemorrhoids. So these fibroid causes hemorrhoids. Okay, hemorrhoids cause करते हैं. दूसरा, they also cause edema. Okay. So these are the main 3 types of the cervical fibroids. Now let's discuss about the broad ligament fibroids. Broad ligament fibroid. Now ये जो broad ligament fibroids हैं ये कैसे बनते हैं? First, when these intramural fibroids generally when they pushed out ना, तो sometimes क्या होगा, वो fibroid जो broad ligament की layers होती हैं उसमें अटक जाता है. ठीक है. When it got stuck in the layers of broad ligament, then this will form what? Broad ligament fibroid. So got it? When the intramural fibroid pushed out in between the layers of broad ligament, it forms broad ligament fibroid. So right, when intramural fibroid pushed out between the layers of broad ligament, it will cause what? It will cause broad ligament fibroid. और जनरली ये जो ब्रॉड लिगामेंट फाइब्रॉइड हैं, they are further classified into 2 varieties, that is, first is the true broad ligament fibroid and second one is the pseudo broad ligament fibroid. Now what is this true and pseudo broad ligament fibroid? मेनली ये जो ट्रू ब्रॉड लिगामेंट फाइब्रॉइड है ना, ये बेसिकली कहाँ से ओरिजिनेट करेगा? दिस ओरिजिनेट्स इन व्हाट? इन ब्रॉड लिगामेंट. So this true broad ligament fibroid originates in broad ligament. Okay, but if we talk about the pseudo broad ligament fibroid, generally ये कहीं और से originate करेगा, but this will encourage towards a broad ligament. So right, it originates elsewhere, but it encourage in broad ligament. Got it? So this is the basically difference. True वाले broad ligament से ही originate करते हैं, but pseudo वाले कहीं और से originate करेंगे, but finally they will be encouraged in the broad ligament. Okay? So ये जो true broad ligament fibroids है ना, these are generally जो ureter है ना, is medial to this true broad ligament fibroid. Okay? बट अगर हम स्यूडो की बात करें तो यहाँ पे जो यूरेटर है इट इज लैटरल टू दीज फाइब्रॉइड्स. हियर यूरेटर इज लैटरल टू दीज फाइब्रॉइड्स. ओके, नाउ let me show this in the image. If this is the uterus, okay, and here I am drawing the broad ligament now. So this is a broad ligament. Okay, अभी यहाँ पे मेनली फाइब्रॉइड है. Here mainly the fibroid is present. ये is the fibroid. Okay, and here is the ureter. Here you will see this is the ureter. So basically जो ureter है that is medial to this fibroid, and ये क्या है, this is a true broad ligament fibroid. बट अगर हम pseudo broad ligament fibroid की बात करें, so if this is the uterus, this is the uterus, here the broad ligament is present. So basically this is the broad ligament. यहाँ पे हमारा ureter है, ठीक है, this is a ureter. ओके, अब यहाँ पे क्या होगा, ये फाइब्रॉइड जो है दिस विल बी प्रेजेंट लाइक दिस. सो ये बेसिकली क्या है, फाइब्रॉइड है. ओके, नाउ कैन यू क्लियरली अप्रिशिएट कि इसके लैटरली दिस इज लाइक यूरेटर इज ऑन द लैटरल साइड ऑफ दिस फाइब्रॉइड. ओके, यहाँ पे जस्ट सी कि यूरेटर जो है इस फाइब्रॉइड की लैटरल साइड पे है मेनली. सो लेट मी ड्रॉ इट अगेन. So this is the ureter and this is the fibroid. So fibroid की lateral side पे ureter है, तो this is what? This is a false broad ligament fibroid. Okay, so this is all about the extrauterine fibroids. Now let's discuss about the Fibroids classification. Fibroids classification. Okay, this is FIGO is what? It is an International Federation of Gynecology and Obstetrics, and according to this they have classified the fibroids into various categories. So here just I want to show you one image. So basically this is a image of this FIGO classification. So according to this FIGO classification, what they have said, there is class 1, that is 0, and this 0 class is submucous fibroid. This is what? Submucous fibroids. And these fibroids are completely in the endometrial cavity. So this class 0, here these fibroids are completely into endometrial cavity. Now can you see this class 0 fibroids? This is the endometrial cavity now, and this fibroid, this is completely in the endometrium. So basically this is what? This is the class 0 fibroid. Okay. Now there is class 1 fibroid. Okay. And these are also submucous. These are submucous fibroids, but here there is more than 50% of fibroid is in the endometrium. More than 50% is in endo. Then there is class 2. Then there is class 2, that is also submucous fibroid, but यहाँ पे there is less than 50% is in endometrial cavity. Okay, so now let's see it in this image. तो क्लास 1 में आप देख सकते हो कि more than 50% fibroid is in endometrium, बस उसमें कुछ 10 to 15% है जो कि कहाँ पे है? myometrium में. अगर हम क्लास 2 की बात करें तो कैन यू क्लियरली अप्रिशिएट दिस इज अ क्लास 2 फाइब्रॉइड. मोस्ट ऑफ दिस फाइब्रॉइड इज इन द मायोमेट्रियम. जस्ट कुछ पार्ट है इस फाइब्रॉइड का जो कि कहाँ पे है? जो कि मेनली एंडोमेट्रियम में है. सो लेट्स सी अगेन. बेसिकली एंडोमेट्रियम ऐसे होनी चाहिए थी. इट शुड बी लाइक दिस. ओके. अब now let's see this type 2. Now see, most of this type 2 is in the myometrium. Only less than 50% is present in the endometrium. Type 1 में most of the fibroid is in endometrium, and 0 में completely जो fibroid है वो endometrial cavity में present है. ठीक है. Now third one is intramural. So here most of the fibroid is in the intramural space, but it is just touching. You can say this intramural fibroid of class 3 is just touching the endometrium, but still this fibroid is in the intramural space. So fibroid just touching endometrium, but it is intramural. It is 100% intramural. Okay. So now see this third fibroid class 3. So it is just touching the endometrium. Okay. पर मैक्सिमम कहाँ पे है? ये 100% इंट्राम्यूरल स्पेस में ही है. नाउ द नेक्स्ट क्लास इज क्लास 4th. दिस इज ऑल्सो इंट्राम्यूरल and this fibroid is 100% intramural. This is not even touching the endometrium. So can you clearly appreciate? This is the class 4th fibroid. Okay. Now then there is class 5th fibroid. Class 5th fibroid. This is subserous or subserosal fibroid. And here more than 50% is intramural. Means some of this fibroid is in the subserous space, but still more than 50% is where in the intramural space. So can you appreciate? कुछ half इसका serous space, it is like touching the serous layer, but most of them जो fibroid का part है वो कहाँ पे है? इंट्राम्यूरल स्पेस में है. So this is class 5. Now the next is class 6. Class 6 is subserous. यहाँ पे there is less than 50% is intramural. So यहाँ जो fibroid है ज़्यादातर कहाँ पे है? Subserous space में है. This is what subserosal fibroid mainly. Only less than 50% is present in the myometrium. Okay. So this is the type 6 of fibroid. Now the next class is class 7th. This fibroid is subserosal, but this is pedunculated. This is what? Can you clearly appreciate this peduncle here? So this fibroid is pedunculated. Pedunculated serosal fibroid. Okay. And then there is the last class, that is class 8, and these fibroids are extrauterine fibroid. Means these fibroids can be present in the broad ligament, these fibroids can be present in the cervix. Okay, so these are the extrauterine fibroid. So got it? So these are the FIGO classification of fibroid. So you need to just rectify it. Now let's discuss about the pedunculated fibroids. Pedunculated fibroids. So basically these are the fibroids with pedicle. Okay, इनके पास pedicle present हो. ठीक है, जैसे ये हमारी यूट्रस है. ठीक है, ये है इस फाइब्रॉइड की पेडिकल और ये फाइब्रॉइड अटैच्ड है विद द यूट्रस विद द हेल्प ऑफ दिस पेडिकल. ओके, एंड इनको हम बोलते हैं पेडंक्यूलेटेड फाइब्रॉइड्स. अब क्या हो सकता है, सम टाइम ये जो पेडंकल है फाइब्रॉइड की ये टूट सकती है. देयर कैन बी द ब्रेकेज ऑफ दिस पेडंकल एंड उसके बाद क्या हो सकता है, ये फाइब्रॉइड कहीं पे भी ऐसे ही घूमता रहेगा. इस फाइब्रॉइड को हम बोलते हैं वेंडरिंग फाइब्रॉइड. वी कॉल दिस फाइब्रॉइड एज वेंडरिंग फाइब्रॉइड. सो वेंडरिंग फाइब्रॉइड को आप कैसे डिफाइन करोगे? व्हेन पेडिकल of pedunculated fibroid breaks, we call it as wandering fibroid. Okay, so just got it. Now let's discuss about the symptoms that you're gonna see in case of a woman who is having fibroid uterus. So let's discuss about the symptoms of fibroid uterus. So here the first symptom you're gonna see is what? That is, so generally अगर हम symptoms की बात करें तो most of them are asymptomatic. Asymptomatic होते हैं ये. Around 75% cases of the fibroids are asymptomatic. Now second जो complaint होती है इनमें, that is abnormal uterine bleeding. There will be presence of abnormal uterine bleeding. Okay, this can be menorrhagia or metrorrhagia. Menorrhagia or metro. Okay, after that there will be dysmenorrhea. There will be dysmenorrhea. Now what is dysmenorrhea? Dysmenorrhea is painful menstruation. So when there is a pain during the menstruation, we called it as dysmenorrhea. और यहाँ पे जो dysmenorrhea होगा, this will be secondary dysmenorrhea. Secondary क्यों बोला हमने? क्योंकि this is because of some underlying pathology. Okay, primary is a physiological one, whereas secondary dysmenorrhea is because of some underlying pathology. Fourth symptom here is dyspareunia. That is dyspareunia. Dyspareunia means when there is a pain during sexual intercourse, we termed it as dyspareunia. तो यहाँ पे ये present होगा. Fifth complaint of this female is what? That is subfertility or decreased fertility, you can say. There will be decreased fertility. So maybe this female is going through some fertility issues as well. Then this fibroids can lead to the pressure symptoms. There will be pressure symptoms because of increasing size of fibroid. So अगर ये fibroid bladder पे pressure create करेगा तो there will be more urinary frequency, or you can say there will be retention of urine. Anything can be there. Ureter पे it can cause pressure symptoms, and even on rectum it can cause pressure symptoms. अगर rectum पे इसने किया तो it can cause constipations. Now seventh is there will be recurrent pregnancy loss because of this fibroid. Recurrent pregnancy loss. ओके, मिसकैरेज हो सकता है, प्री टर्म लेबर हो सकती है, कुछ भी हो सकता है. क्योंकि सी इफ दिस इज अ यूट्रस, यहाँ पे अब अंदर इस यूट्रस के फाइब्रॉइड प्रेजेंट है, दिस इज अ फाइब्रॉइड, तो बच्चे को प्रॉपर जगह नहीं मिल रही है ना ग्रो करने के लिए. एंड फाइनली व्हाट विल हैपन? दिस विल लीड्स टू द अबॉर्शन और प्री टर्म लेबर. ओके, नाउ द eighth symptom that you will see, there will be lower abdominal pain. So there will be presence of lower abdominal pain, या इसको हम pelvic pain भी बोलते हैं. ठीक है, there will be pelvic pain. And the next and last symptom is what? That is there will be abdominal enlargement. See, अगर फाइब्रॉइड है, अगर उसका साइज ग्रो करेगा तो ऑब्वियसली देयर विल बी इंक्रीज इन द साइज ऑफ यूट्रस, तो फाइनली आपके एब्डोमेन का साइज भी बड़ा होगा. सो देयर विल बी एब्डोमिनल enlargement. Okay, So these are the some signs you're gonna see in case of fibroid uterus. Most of these are asymptomatic. Then there will be abnormal uterine bleeding जिसमें mainly menorrhagia or metrorrhagia होगा. After that there will be dysmenorrhea, mainly this is secondary type of dysmenorrhea. Dyspareunia, decreased fertility, pressure symptoms that can be because of compression of bladder, ureter or rectum. And then recurrent pregnancy loss, low abdominal pain, and finally abdominal enlargement will be there. Now let's discuss about the specific symptoms to each fibroid. So if we talk about submucosal fibroid, so what are the specific symptoms that is mainly related to this fibroid? First is infertility and abortion. Infertility and abortion is linked with submucosal fibroid. And second one is menorrhagia. Menorrhagia, actually it is not a specific symptom. It can occur in other fibroids also. Okay? So eventually this submucosal fibroid can cause necrosis. This can cause infection as well. And this can also lead to what? That is polypoid changes. Okay, so these are the some particular characteristics that are linked with submucosal fibroids. Okay, now let's talk about the second fibroid, that is the subserosal fibroid. So mainly जो pressure symptoms होते हैं ना, that are linked with this subserosal fibroid. So pressure symptoms are linked with them. So this is specific to subserosal fibroid. Okay. Now how you gonna do the investigation? So if they ask you investigation of choice, so what will be your answer? That is, you will go for ultrasound examination. And if they ask you the best method, so best is MRI. ठीक है, MRI कर सकते हो आप. And for follow up, always we will use ultrasound examination. Now what are the complications these fibroids can cause? So let's discuss about the complications of fibroids. Okay. Now in these fibroids, degeneration can occur. Second, atrophy can occur. Third, necrosis can occur. Fourth, there can be infection. After infection, there can be vascular changes you can see. And fifth, there can be what? Sarcomatous changes. So these are all the complication of these fibroids. Degeneration, atrophy, necrosis, infection, vascular changes and the sarcomatous changes. So now let's discuss about the degeneration. So degeneration. There are different types of degeneration that you're gonna see here. So first you can see hyaline degeneration. Second, You can see the calcareous degeneration. Third, you can see the cystic degeneration. Fourth, you can see fatty or myxomatous degeneration. Fifth, you can see the red degeneration. Okay, so now let's discuss about each of them. So first, we're gonna discuss about hyaline degeneration. So this degeneration generally affects all sized fibroids. ठीक है, इसमें सारे साइज के फाइब्रॉइड्स इफेक्ट होते हैं एक्सेप्ट जो बहुत छोटे, द टाइनी फाइब्रॉइड्स आर स्पेयर्ड. ओके, सो दिस degeneration affect all sized fibroids except tiny fibroids. ओके, जनरली ये जो डीजनरेशन है ये उन फाइब्रॉइड्स में ज़्यादा कॉमन है जिनमें कनेक्टिव टिश्यू ज़्यादा प्रेजेंट हो. इट इज कॉमन इन फाइब्रॉइड्स with more connective tissue. ओके, सो नॉर्मली क्या होता है कि हाइलाइन डिजनरेशन में जो सेंट्रल पार्ट है फाइब्रॉइड का वो ज़्यादा इन्वॉल्व होगा. ठीक है, सो मोस्ट कॉमन साइट क्या है, दैट इज सेंट्रल पार्ट ऑफ फाइब्रॉइड इज मोर कॉमनली इन्वॉल्व इन हाइलाइन डिजनरेशन. क्यों है ऐसा, वाई सो, बिकॉज इट इज द लीस्ट वैस्कुलर पार्ट. इट इज लीस्ट वैस्कुलर and it has more connective tissue in it. Okay, after that, when you see this degeneration on cut section, तो ये कैसी दिखेगी, you will clearly appreciate the irregular homogeneous area, irregular homogeneous area with loss of whorl appearance. With what? With the loss of whorl appearance of fibroid. Now when you see this degeneration on microscopic examination, when you do the microscopic examination, you will clearly reveal the hyaline changes. So you can see hyaline changes of muscles and fibrous tissue. Fibrous tissue. Okay, now let's discuss about the second degeneration, that is cystic degeneration. Cystic degeneration generally मेनोपॉज के बाद ज़्यादा देखने को मिलेगी. So it is most commonly occur after menopause. Okay, ये कहाँ पे होगी, जनरली इंटरस्टिशियल फाइब्रॉइड्स में ज़्यादा सिस्टिक डिजनरेशन होती है. occur in interstitial fibroids. ओके, नाउ यहाँ पे आपको क्या देखने को मिलेगा, along with the hyaline changes you can clearly appreciate the cystic changes. mainly यहाँ पे क्या होगी, liquefaction हो जाती है of the particular area. so along with hyaline changes, there will be liquefaction of fibroid area of fibroid. Okay. After this cystic degeneration, let's discuss about the fatty degeneration. Fatty degeneration, which is also called as myxomatous degeneration. Here, this is generally also present after the menopause. So, fatty degeneration भी menopause के बाद ज़्यादातर होती है एंड यहाँ पे क्या होता है, जो फैट ग्लोब्यूल्स हैं वो जर्नली डिपॉजिट हो जाएंगे मसल के सेल्स में. ठीक है. सो देयर विल बी फैट globules deposition in muscle cell. Okay, so this is called as the fatty degeneration or myxomatous degeneration. After this fatty degeneration, let's discuss about the calcific degeneration. Calcific degeneration. This degeneration generally involves a subserosal fibroids. This mainly occur in subserosal fibroids with pedicle mainly. Okay. यहाँ पे क्या होता है, you will see there is a precipitation of calcium carbonate or phosphate within the fibroid. So here mainly calcium carbonate or you can say phosphate precipitation occurred in the fibroid. Okay. And when this whole tumor converted to calcific mass, we called it as womb stone. And when this whole tumor is converted to calcific mass, we called it as what? We called it as womb stone. ठीक है, womb stone. Here they can ask you a question where you gonna see the womb stone appearance. So mainly in case of calcific degeneration you will see this. Okay. After that, the next degeneration that you need to remember is the red degeneration. Next one is the red degeneration. So ये जो red degeneration होती है ना, generally it occurs in the large fibroids. This occurs in large fibroids और मेनली ये प्रेगनेंसी के सेकेंड ट्राइमेस्टर में ज़्यादातर होती है. दिस मेनली अकर मेनली इन सेकेंड हाफ ऑफ प्रेगनेंसी. ठीक है. रेड डीजनरेशन जनरली क्यों होगी? दिस जनरली रिजल्ट्स फ्रॉम सॉफ्टनिंग ऑफ द कनेक्टिव टिश्यू that mainly surrounds the or you can say mainly supports the fibroid. Okay. ये जो red degeneration है ये कहाँ पे होती है? मेनली जो सपोर्टिव कनेक्टिव टिश्यू है ना अराउंड द फाइब्रॉइड उसमें ये होती है. ठीक है. और बेसिकली क्या होता है, ये जो कैपिलरीज होती है ना वो रप्चर हो जाएंगी एंड देयर विल बी ब्लड इफ्यूजेस आउट टू द मायोमा. सो मेनली this occur in supportive connective tissue and क्या होगा, जो कैपिलरीज हैं, the capillaries will rupture and blood from capillaries effuses into what? Into myoma. ठीक है. This will cause what? This will cause the reddish discoloration of the fibroid, causing reddish discoloration. ओके. और जब आप इसको कट सेक्शन पे देखोगे, when you see this on cut section, you will clearly appreciate that raw beefy appearance. Raw beefy appearance of fibroid with cystic spaces. With cystic space. Okay. और ये raw beefy red appearance क्यों आ रही है? Because of the hemolyzed RBC. This is mainly due to hemolyzed RBCs. Okay. So generally red degeneration में you can feel that fishy odor. So यहाँ पे जो odor होता है that will be fishy. Now why this odor will be fishy? Because of the fatty acid deposits. Due to fatty acids. Due to fatty acids. Okay. And on microscopic examination, you can see there is necrosis. Necrosis is present there. Now, can you appreciate this image? तो यहाँ पे आपको clearly ये beefy red appearance देखने को मिल रही है ना? So basically, this is the image of red degeneration. This is what? This is image of red degeneration of fibroid. Okay. Now the next complication that can occur is the atrophy. Atrophy of fibroid. Now atrophic changes generally occur after the menopause. Why? Due to the loss of estrogen hormone. ठीक है. So atrophic changes occur after menopause due to loss of estrogen or due to decreased support from estrogen, and hence ये जो size है tumor का, this will decrease. There will be decrease in size of tumor. Okay. Now next we'll discuss about how you gonna manage this condition. So management mainly अगर हम red degeneration की management की first बात करेंगे. So for managing the red degeneration, what you will do? You will do the conservative management. यहाँ पे हम conservative management ही कर पाएंगे. Have to do conservative management. Now what are the indicators of malignancy? Indicators of malignancy in fibroid. So mainly if the size of this fibroid is increased suddenly, then this is the one of the indicator. So sudden increase in size is an indicator. Second, when the whorl pattern of fibroid is lost, then also it is turning into malignant condition. So loss of whorl appearance. Third indicator is softening of fibroid. When the fibroid becomes softer, you can think of malignancy. And fourth is if there is a pain. Usually fibroids में pain नहीं होती है, but when there is a pain in the fibroid, so you can think of malignancy. Okay. Now I want to show you one image. So here, can you see this mass with white spots in it? This is nothing but the calcified mass. This is what? This is a calcium carbonate deposits in fibroid. So basically this is what? This is calcific degeneration of fibroid. और इसको हम क्या नाम देते हैं? We called it as womb stone. This is basically a womb stone appearance. Okay. So again, let me drop this. This is a womb stone appearance of fibroid. Now, what are the investigations you're gonna do for the diagnosis of fibroid? So investigations. Now, if we talk about investigations for submucous fibroid, so what you will do? First, you will go for ultrasound examination. USG करोगे first. और मेनली हम कौन सी USG करेंगे? That is transvaginal sonography. After transvaginal sonography, you can do sonohysterography और जिसको हम क्या बोलते हैं? saline infusion sonography. Third investigation that you can do is hysteroscopy. Hysteroscopy में हम क्या करेंगे? We will insert camera inside the uterus and will see for the fibroid. ठीक है? After that, what you can do in the investigation, that is you can go for MRI. Generally जो MRI है, this is more accurate than the ultrasound, and MRI का एक benefit है over the ultrasound. अगर आप MRI करते हो fibroids के patient में, तो what if this female is having adenomyosis, हम उसको fibroids मान के चले पर वो adenomyosis हो तो so MRI क्या करती है? It helps you to differentiate between adenomyosis and fibroid. So just remember, MRI is way more better than USG and it helps to differentiate between adenomyosis and fibroids. Okay, and after that you can also go for laparoscopy examination. After laparoscopy, you can even do the uterine curettage. You can do. So these are the investigation that you can do for the diagnosis of fibroids. So just rub it, not for submucosal. For all those fibroids, you can use this investigation. Okay. Now the management of the fibroids mainly depends on the symptoms. So management depends on symptoms. Okay. Now first case is if the patient is asymptomatic. If a symptomatic patient is there and the size is less than 10 centimeter, then what you have to do? You just have to do the serial monitoring of this fibroid by USG. So mainly you have to do serial monitoring by USG. Okay. Now, second case is if this female is symptomatic. If she is symptomatic. Now, there is two scenarios. If this female is multi-pari, if she is multi-pari means 2-3 बार प्रेग्नेंट हो चुकी है वो, तो अब आप क्या कर सकते हो? You can go for hysterectomy. You can remove the uterus. Okay, you can go for hysterectomy. That is total abdominal hysterectomy you can do. But even though she is a multipara, she don't wants to remove the uterus. She don't wants to undergo hysterectomy. तो आप क्या करोगे? But if she is unwilling, or you can say contradicting to surgery, then what you will do? Then आप कर सकते हो uterine artery embolization. Uterine artery embolization कर सकते हो. With what? With polyvinyl alcohol और gel form use कर सकते हो. Alcohol और gel form of this you can use. Okay. अगर वो symptomatic है, multipara है and she don't want further child, so you can go for hysterectomy. But अगर वो surgery नहीं करवाना चाहती तो in that case what you will do? You can go for uterine artery embolization with polyvinyl alcohol. Okay. Now you can also go for MR guided high intensity focused USG. Guided high intensity focused USG. Okay. Second scenario is now if she is nulliparous and obviously she wants child in future also, so what you can do? And wants child. So in this case you can go for myomectomy. Myomectomy, that is removal of the fibroid only. Okay. And for this we generally use Bony's myoma screw. For this we use Bony's myoma screw. ये screw हम use करते हैं to hold the fibroid. We use it to hold fibroid. Now can you see this screw? This is what? This is Bony's screw. ठीक है. ये जो screw है इससे हम क्या करते हैं? अंदर लेते हैं, myoma में fix करते हैं and then we pull it out. ठीक है. This is generally used to hold the myoma. Okay. We generally use that clamp to release the blood supply. So there is one more thing, that is Bony's myoma clamp, and this we use to intermittently release blood supply. Okay. Now if this patient is unwilling, if the patient is unwilling. So what other things you can use in that patient? If unwilling to surgery, so what you can do in this case? You can give her medical treatment. Medical treatment you can give if she don't want surgery. So for that, what drugs you can use? You can use continuous gonadotrophin releasing hormone. आपको पता है जनरली gonadotrophin releasing hormone अगर pulsatile manner में आप दोगे, so this will stimulate the estrogen and progesterone production. ठीक है, बट अगर आपने उसको continuous manner में दिया, so there will be less estrogen and progesterone, so that's why you can use this in the treatment of fibroid. Second thing that you can use, that is danazole. You can use danazole, but the side effect of danazole is hirsutism. This is mainly anti-estrogenic drug. Okay, this danazole is anti-estrogenic. After danazole, you can also go for gestrinol. Okay, this is having same action as of danazole. Then you can also give letrozole to this patient. After that, other medical treatment, you can give mifepristone or ulipristal. Mifepristone and ulipristal. Okay, these are mainly anti-progesterone drugs. Anti-progesterone drugs. Okay. So for excessive bleeding, you can give tranexamic acid. Along with iron supplementation. Okay, so in this way you can treat this patient. Now if this female is having mainly submucosal fibroid up to 5 cm, if this female is having submucous fibroid up to 5 cm, so you have to you can remove this fibroid by hysteroscope. So you can remove it by hysteroscope. Okay. If she is having subserous and intramural fibroid, subserous plus intramural fibroid, and the size of these fibroids are up to 10 centimeters, then what you can do, you can remove this with what? With laparoscope. And in case of subserous fibroid, now you can remove this easily during C-section. If a female with pregnancy is having subserous fibroid, so you can remove this with C-section. Okay, when you are doing C-section, so you can remove this during C-section. Just write it during. Okay, so now let's again discuss about the treatment. So जो मैनेजमेंट है इसकी डिपेंड करेगी सिम्टम्स पे. अगर दिस पेशेंट इज एसिम्टोमेटिक मीन्स द फाइब्रॉइड साइज इज लेस देन 10 cm, you will do the monitoring of the fibroid by USG examination. After that, if the symptoms are there and this female is multiparous, you can go for hysterectomy. But if she is unwilling for that, then you will do what? Uterine artery embolization with polyvinyl alcohol. If this female is nulliparous, means if she wants a child in future, then you can go for myomectomy, generally by a use of one instrument, that is Boni's myoma screw, and this screw generally we use to hold the myoma. After that, there is a Boni myoma clamp that generally used for intermittently releasing the blood supply or to the myoma. And if this female is unwilling for surgery, you can go for medical treatment. And what drugs you can use? You can use continuous growth gonadotrophin releasing hormones. You can use danazole, you can use gestrinone. But the side effect with gestrinone and danazole is they can cause hirsutism. And after that, you can use letrozole and antiprogesterone like mifepristol and ulipristal. Okay. Now, if she is having excessive bleeding, you can give tranexamic acid along with iron supplementation. Now, if we talk about the specific treatment to the fibroid, like submucosal fibroid, if it is of up to 5 centimeter, then in this case you can go for hysteroscope removal of this fibroid. And if there is a subserous and intramural fibroids up to 10 centimeter, then you can go for laparoscope removal of this fibroid. And if there is a subserosal fibroid in a pregnant lady, then you can remove this during C-section. So guys, this is all about the fibroids. I hope you guys like this video. So thanks for watching.